Dr. Jon Runion here, and we're putting together a video to talk about frequently asked questions and some of the most common issues that you may face after a dental procedure. And hopefully you like the video and it gives you a lot of useful information. So one of the most common issues that we have, our patients talk about their lips being very dry and sometimes even cracked after a lengthy dental procedure. So what we do in the office is we are constantly applying regular Vaseline to your lips at the beginning and throughout the entire procedure. So what we always suggest is afterwards that you continue that process. We supply you with a chapstick, but ultimately you can use any type of chapstick or any type of Vaseline to just really keep those lips hydrated and heal any cracks that may be there or prevent any drying or cracking going forward. So important key, keep the lips hydrated. Another common situation that we face after a dental procedure are the formation of mouth and lip ulcers. Those ulcers can form for various reasons and can come up even a few days after the procedure. They are very painful, they can be very annoying, but ultimately with time they will heal, and unfortunately they are relatively common after lengthy dental procedures. So if you do notice that there are ulcer formations, go ahead and just start treating them with normal salt water rinses, which is what you should be doing anyway to kind of help your mouth heal, but just really kind of focus that rinse around the areas that have those ulcerations. Other than that, there's not much you can do to help heal those other than time. So we always say, rinse it with salt water and just be patient as your body will heal those with time. With mouth ulcers that linger for more than a week or so or seem to be getting worse, we do want you to contact us and we will invite you in for an evaluation so that we can make sure that they are in fact mouth ulcers and see if there is anything that we may be able to do to help heal those or prevent any type of infection setting in. So those long-lasting mouth ulcers, please contact us and we'll have you come in for an evaluation. A common issue after a lengthy dental procedure is that the floor of your mouth and underneath your tongue or the tongue itself can be very, very sore. You'll notice that soreness when you try to swallow, talk, or really any type of movement with your mouth. It seems weird because that's not really where the teeth are, it's underneath the tongue, but those muscles and that whole area is just inflamed and sore from all the work that's being done, and the swelling and inflammation from the jaw itself is kind of funneling down and settling into that area. So that's why that soreness can be so prominent down in there. We will tell you that that's a normal finding and that just taking the anti-inflammatory and pain medication that we give you is going to be your main thing to combat that pain, but also just limiting yourself to, unfortunately, a soft diet, ice kind of around your jaw area, and just rest, nutrition, and hydration are going to be the things that are going to help your body heal and get better as fast as possible. So floor of the mouth can be very sore, especially when swallowing and talking. We think that's a normal thing. If it persists for greater than a week or so, we want you to come in so we can evaluate and make sure nothing else is going on. Another post-operative finding that we see quite frequently is your jaw joint, kind of right in front of your ears, and also this whole muscle that runs down into the corner here can be very sore, especially when you try to open wide, when you're trying to talk, and when you're trying to chew. So what we tell you is, just like with any muscle or joint injury, you're going to stretch, you're going to do ice and heat, you're going to do massage, and you're going to do that very frequently. The more work you put into that jaw joint and the muscle, the faster it's going to heal and the quicker you are going to recover. So what we tell people that really come in and they just say their jaw and their muscles sore, we say, listen, you got to get into that physical therapy routine of stretch, massage, ice, and heat. And that'll make that stiffness and soreness go away very, very quickly. Also, your regimen of anti-inflammatories and pain medication are always going to help with that process as well. So When you get that sore jaw and that sore muscle, just like anything in your body, you're going to go through that physical therapy and it's going to heal up quick. Sometimes after lengthy dental procedures, patients will tell us that they have a lot of saliva in their mouth, and they've actually have a lot more saliva than they've ever had before. And that is a very common situation, and we do consider that to be normal. And your body will eventually go back to normal salivary production. And the reason for that excess salivary production is your body is responding to the newness that's in the mouth. So if you have a new full arch of teeth placed, or sometimes just a new set of veneers or crowns, your body is going to kind of react to the new material or the new prosthesis in your mouth, and its reaction is to actually produce more saliva. So there's not a whole lot you can do to make that go away, but we do want you to know that that's a normal finding, and it will eventually return to normal. So a little extra saliva in there is not bad, and it will return to normal over time. So after one of our full mouth reconstructions, where we're redoing a full arch of teeth or a set of veneers or a set of crowns, you're going to notice a change in the speech. And that is a very normal finding, and we actually expect that to happen. The good thing is the human body is very adaptive, and you are going to go back to normal speech very soon. What we offer is to practice speaking. And the more that you do that, the faster your speech will return to normal. So some suggestions would be to read a newspaper or an article on your phone. Just read it out loud. And that practice will train your tongue and your lips to form the proper speech. And the more you practice, the better you're going to get and the quicker it's going to happen. So just like anything, practice makes perfect. So after we do a full mouth reconstruction and we give you a whole new set of teeth, you are going to notice a very dramatic shift in the chewing formation of these teeth. And the reason is that the teeth that we put in as your immediate set of temporaries are going to have a very flat, a very neutral anatomy to the cusps or shapes of the teeth. And that is done on purpose so that you can transition easily into this new set of teeth. But what we do want you to know is that that is just temporary, and that will ultimately be adjusted and changed as we progress through your new sets of teeth. So those first set of teeth that you come out with after surgery, those are going to be flat. They're going to have a very neutral kind of shape to them. And because of that, you're going to have a different feel when you chew. But we do want you to know that we're going to work through that new chewing function, that new bite, and we're going to do that through a series of adjustments that's going to happen during your checkup. So what we always just offer is be patient with the process, really focus on chewing your food well, and doing the best you can with practice through this transitional period. And as we progress and make adjustments and get you into your new set of teeth, you will notice that you gain ideal chewing function that's going to last for the rest of your life and serve you very well.